And for those who don't know, there is a ServiceLink office in every county, but we are undergoing and in the middle of a name change. And the reason why I just want to just very briefly mention that to you, we're now called Aging and Disability Resource Centers. So we have started to answer the phones. Some of us, sometimes you call, there'll be a recording directing you where to call, and the recording will say Aging and Disability Resource Center, formerly ServiceLink. Sometimes I'm saying Aging and Disability Resource Center, formerly ServiceLink, but some of us are answering the phone ADRC. The only reason that's important is when you tell clients, obviously, if they call thinking they're getting ServiceLink and they know ServiceLink, if they hear ADRC, it might confuse them. So please, if you can, let them know it's the same program. It used to be called ServiceLink. They just changed their name. And so we just don't want them being thrown off that they think they've dialed the wrong number, dialed the wrong, or the wrong program or whatever. So just, if you could help us out, we're doing the best we can. Sometimes it's just too much of a mouthful for me to say Aging and Disability Resource Center, formerly ServiceLink. So I'm still saying ServiceLink, whatever, but we have undergone that name change, and whatever help you can give us in making sure clients know it's the same people, same program, same help, same whatever, just a different name. So anyway, so one of the reasons that the Aging and Disability Resource Centers were asked to talk about Medicare is, for those who do not know, every state in the country has a program called State Health Insurance Program, also known by its initials SHIP. So we are referred to as SHIP counselors. We are certified Medicare specialists. The state requires us and the federal government requires us to go through yearly testing. Don't worry about it. I did pass. I just took it a couple of weeks ago. So I'm good. But the reason that's important is we want to instill confidence in people that we're talking to, that we are specialists in Medicare, and that they can have a high level of confidence in the information that we share. So specifically, I can understand why you would want to have someone talk to you about these Medicare savings programs, because it's probably something that comes up with the clients that you're dealing with. But I want to start with something. We don't work for the Department of Health and Human Services. We're not employed. So when we talk about policies that are established by the Department of Health and Human Services and these Medicare savings programs, and who's eligible is established by the Department of Health and Human Services, I like to let people know I'm not telling you policy. I'm just telling you based on my knowledge, this is the situation. And I tell you that because you need to give yourselves permission. If you're talking to somebody about these Medicare savings programs, you don't have to have all the answers. It's obviously going to be very valuable to have the information that I'm going to present to you today, but it's also okay to say, this is a case-by-case basis. I don't have the answer to that particular question. You're going to have to discuss that with somebody at the Department of Health and Human Services. I really think that's important. There are just too many specifics. You don't have to have all the answers for people. The other thing that I have learned is the language that we speak is so important. As I kind of kiddingly say, when it comes to Medicare, I consider myself to have an advanced calculus knowledge, but can I teach basic math? And sometimes it's so important to put this in terms that people understand. So when you're dealing with clients, that they get a full understanding of what we're talking about. So I just wanted to, those are kind of two basic points that I truly believe in. The short answer about Medicare savings programs is that basically people who have Medicare as their primary health insurance can get help paying for their Medicare costs through what the state offers them, and the state offers Medicare savings programs. I don't know what you do or don't know about Medicare, but I want to just back up and just give you a quick overview of what Medicare is and put these Medicare savings programs in an important context so that you're going to be able to explain to clients what these Medicare savings programs are all about. Medicare is the federal health insurance program that was established in 1965. It was established to help for the most part, elderly citizens, senior citizens, 65 or over, to have what the federal government considered affordable health insurance to help them pay for their medical costs. It is not based on income. It is based on two things. It is based on your age. As I said, most Medicare recipients, most of the people who have Medicare as their primary health insurance have it because of their age, 65 and older. There are also another group of individuals who have Medicare as their primary health insurance. Anybody who is collecting Social Security disability income for at least 24 months is automatically put on Medicare by the federal government. And again, it is not income based. The federal government is not looking at how much money are you making from Social Security disability income. They're saying you have been collecting Social Security disability income for at least 24 months. We are now putting you into the Medicare system. And there are two groups of individuals who unfortunately are dealing with very serious medical conditions. Someone with end-stage renal disease who meets certain criteria, and also people with ALS who meet certain criteria. They can become almost instantly eligible for Medicare. So I just wanted to make sure you understand who the Medicare recipients are, who you are dealing with. What's very important to understand as you understand the purpose of Medicare savings programs, it's my understanding that many, or if not most of your clients are in the state health insurance system, which of course we know as Medicaid. The difference between Medicaid and Medicare is that Medicaid is based on financial eligibility. And people who are meeting the financial eligibility get the health insurance that they need through the state system. When I talk about putting this in an important context, this is where it becomes important to understand the context between Medicaid and Medicare. As I will tell clients, Medicaid is a very generous program. Most people who have health insurance in America, most people, of course, not everybody, know that health insurance in America, whether you have a private health insurance program, whether you have the Medicare program, meets two basic principles. One, it's not free. If you're working, if you have health insurance through your work, you're paying a monthly premium. And as we all know, we see on our paychecks, this is how much they took out of my paycheck to pay my health insurance premium. If you have private insurance on your own through the health marketplace, you know that you're paying a Medicare monthly premium. That's the first basic principle of health insurance for most Americans. The second principle is the most important principle in my working with people to understand Medicare or other health insurance, and that is that health insurance for most Americans does not pay 100% of the bill. You go to Dr. Jones, you hand them your health insurance card. Dr. Jones's office sends a bill to the health insurance company. The health insurance company sends back most, but not all of the money. So what does Dr. Jones's office do? They send you a bill for the rest of the money. It's that. So basically, to understand that, you have to understand that when you have health insurance for most Americans, you are going to have costs, either monthly premiums or a portion of the bill. And then, of course, we refer in many cases to your portion of the bill as a copayment. But again, I go back to using that word, putting this in context. The state health insurance program for most people on Medicaid, which is based on your finances, is a very generous program. You don't have these costs. There's no, again, for most, there is for some, there's no monthly premium for a lot of your clients who have Medicaid as their primary health insurance. And more importantly, there are no co-payments. So what happens with a lot of Medicaid clients, they then become eligible for Medicare. And again, they become eligible for Medicare because of their age, they're turning 65, or in many cases, and probably with a lot of your clients, they've been on Social Security disability income for 24 months. When that happens, the federal government now puts them on the Medicare system. And the Medicare system, the Medicare program, follows the same principles as most health insurance programs. There's a monthly premium and there are co-payments. So I will tell clients, as you're transitioning from Medicaid to Medicare, with Medicaid, you had a very generous program through the state where there were no costs. You now have a health insurance program that is not as generous. And I literally will say to people, the federal government is not as generous as the state government when it comes to health insurance. And you are now going from a program where there were no costs to a program that there are costs that you will be responsible for. And so obviously that can come as quite a shock to people and come as quite a stress to people to go from Medicaid to Medicare. When that happens, and again, before I start to get into the specifics of a Medicare savings program, one of the first inclinations for people who've gone from Medicaid to Medicare is to say, well, I obviously don't want a health insurance program that's going to cost me money. I would prefer to stay with the state program that's not costing me money. One of the things that we have to tell them is they don't have a choice. The federal government and the state government have gotten together and said, when you are eligible for Medicare, Medicare will be your primary health insurance. That is a decision made by the federal government and the state government. It's not a decision you can reverse. In some cases, the state when the federal government steps in and says to the state, this person is now eligible for Medicare, Medicare will be the primary insurance, the state will walk away, people will get notices, your Medicaid insurance is now being canceled. In some cases, they can have both insurances. When they have both insurances, Medicare is the primary health insurance. When you have two insurances and one is the primary, that means the primary insurance is responsible, what they also call the first payer, it's responsible for paying most of the bill. Okay? Any questions about that? Because I wanted to put that into a context so we can then explain where the Medicare savings programs fit in. Okay. So what happens when you are now eligible for Medicare? Again, for most of your clients, they've gone from a state health insurance program with Medicaid that didn't have costs to
Can we pause for 1 second? A hand did raise here.
Okay. Yeah, I don't see the hand, so.
Yeah,
Emily,
okay. No, okay, no problem. Vishna, do you have a question?
Yes.
Thanks.
Who is getting the SSA, the SSI, and she doesn't have the Medicaid or Medicare. She's not 60 or 67 years old. She's younger, but she has a health condition that she could not work. And I try to figure it out, like if I can apply for the Medicaid or Medicare, and their income is her husband make more money.
I thought I heard you mention SSI and not SSDI, and there is a difference. Social Security disability income means that a person applied to the federal government, to the Social Security Administration, and said, I have been paying into the Social Security system for many years. Under normal circumstances, when I get into my 60s, I'm going to ask for that money back, Social Security retirement income. But something, unfortunately, has happened. I can no longer work. I need that money before I hit my retirement age. And you apply to the Social Security Administration, you document that you have a disability. If the federal government, the Social Security Administration agrees, they give you that money, Social Security disability income. But they give you the money because you work enough years. It's basically, they call them quarters. And they say 40 quarters, which is basically 10 years. You worked 10 years of your adult life. You paid into the Social Security system. That money that's waiting for you to, when you hit your early or mid 60s, you can have it now. But if you have not worked enough quarters, you are not eligible for Social Security disability income. Instead, we're going to turn, but if you are on, if you need money, we will give you, there's a separate fund called Supplemental Security Income. And that means we will give you some monthly income because we don't want you to be destitute and have no money. The difference is, because you worked enough quarters and qualify for Social Security disability income, you will qualify for Medicare after 24 months. If you are collecting SSI, it's a case-by-case basis. You may or may not be eligible for Medicare.
So it is SSDI or SSI. I'm not fully aware of it because he's getting $1,700 or $1,600. Maybe it is SSDI. And
if a person is getting $1,600 to $1,700 a month, I'm 99.9% sure that is SSDI. Yes. SSI are for people, there's a limited amount of income that the federal government's going to give you. They're going to give you up to the federal poverty level, which is well below the $1,600 or $1,700. So somebody making $1,600 to $1,700, I would 99.9% bet that they're getting SSDI, which would make them Medicare eligible.
So can she apply Medicaid and Medicare together because she's younger?
You can apply for Medicaid, but if you're collecting Medicare, the only way that you're going to be possibly eligible for Medicaid is if you also apply for APTD, Aid for the Permanently and Totally Disabled. You would basically say, so to just go back to Medicaid, and again, I want to be able to switch over to Medicare savings programs. The federal government's Medicare program is not based on income. It's based on age and disability. The state program is based on financial eligibility. So you can apply to the state for a secondary insurance, Medicaid, but it's going to be based on your financial eligibility. But whether you get Medicaid or not, Medicare, when you become Medicare eligible, Medicare is your primary health insurance, and you have no say in that. That is a decision that the federal government has made in partnership with the state governments. Medicare is your primary health insurance. If you are eligible for a second insurance through the state Medicaid system, then it will become what's known as a secondary insurance. I can explain that in a little bit, what it means when you have a second insurance. But I just want to go back to the people who transition from Medicaid to Medicare, and you can imagine the stress. I'm on Medicaid. I have not had to pay a monthly premium, and more importantly, I had no co-payments. My bills were covered by the state 100%. Now you're telling me all of that ends. You're telling me I have a monthly premium, which in 2025 is $185. And if I go to Dr. Jones, if I go to a clinic, if I go to, God forbid, I'm hospitalized, I'm going to be responsible for a portion of the bill. So you imagine the stress that causes people. So what happens then? They then can turn to the state and say, the federal government put me on this federal health insurance program through the Medicare system. I cannot afford it. I can't afford the monthly premium of $185. And God forbid, there are a lot of co-payments. I cannot afford them. So the state government's response is, okay, let's take a look and see if you qualify for these Medicare savings programs, meaning the state will help you with your costs. Depending on your income and your assets, the state will determine your eligibility. There are two forms of eligibility, and you've probably heard these initials kicked around. The first form of eligibility is the lowest of income and the lowest of assets. And I want, before I get into specific numbers, we so often, when it comes to the state, talk about monthly income. Am I eligible based on my income? This is a program where the state says we're not just looking at your income. We're looking also at your assets, checking account, savings account, retirement account, life insurance policy, et cetera. What the state is saying is you may be on limited income, but you've got $100,000 tucked away. You could use that to pay your medical expenses if you needed to. So that it becomes a part of the eligibility. So the lowest of income and assets is the first level of eligibility, called qualified Medicare beneficiary. Nobody uses that term. Everybody uses its initials, QMB. In 2025, and again, this is where I say you don't need to remember these numbers off the top of your head. You can say to people, it's approximately this, and help them, apply for the eligibility. But in 2025, the eligibility income is around $1,250. It's actually $1,255 for a single person. A married couple, it is $1,000. It's about $1,700, actually $1,704. So to me, well, I'll tell people it's about $1,250 for a single person and $1,700 for a couple. The assets are $9,600 for a single person and $14,500 for a couple. If they qualify for QMB, the state says to them, we will pay your monthly premium of $185, and we will also pay all of your co-payments. So the state is basically telling them all of those costs that you now have to incur by being in the Medicare system, the state is going to take care of that for you. Again, it's because it's the lowest income and lowest asset eligibility that the state is basically saying to them, you will be able to switch from the state's health insurance program to the federal government's insurance program, and you will not have any costs. So that is what is called the QMB program. The second level, the income level for a single person goes up to about $1,700 for a single person, about $2,300 for a married couple. It's called Specified Limited Medicare Beneficiary, commonly known by its initials SLMB, and the state will help. What the state will offer is they will pay your Medicare premium of $185, but offer you no other financial assistance. So
Can we pause for 1 second?
Yes.
Sorry, really quickly before we continue. There's a question in the chat. It says, are child support payments considered an expense when qualifying for QMB?
The state will look at all income. So the state looks at income. Basically, they want to know, do you have the money to pay these expenses yourself?
Thank you.
Okay. And again, those are situations where you can say to people, you may or may not be eligible. I encourage you to apply and let the state. I don't tell people you are or are not eligible, because I'm not doing somebody else's job for them. I'm not going to do the job of a state worker sitting in an office to determine the eligibility for these Medicare savings programs. So I'll tell people, I encourage you to submit an application. If you're deemed not eligible, that will be a decision made by someone at the Department of Health and Human Services. So basically, that is what you're doing, is when people are transitioning from Medicaid to Medicare, and they're told all of a sudden they are hit with these expenses, it hits them like a ton of bricks. And you can imagine the stress And that's where we say, before you have to worry about the costs, let's see if we can transition you into a program where the state will help you with those Medicare costs. I also want to go back to one of the programs that I talked about, the QMB program. As I said, the QMB program is where the state steps in and says, not only are we going to pay the Medicare monthly premium, but those co-payments, you went to Dr. Jones, your Medicare insurance did not pay 100% of the bill. The state is going to pick up that co-payment. It's extremely important to make sure people understand something. When they walk into a doctor's office or a hospital, it is very important that they let the medical provider know that they have this QMB program, and here is why. If you do a Google search and put in CMS Medicare QMB, it's going to bring you to a page on the official website of the federal government, and it's going to say, federal law prohibits any medical provider from billing anybody on the QMB program. The reason that this is important, a couple of reasons, is a lot of the medical providers don't know about this program, and they won't know your clients are on this program. They will send the bill to Medicare. Medicare will pay most of the bill. They will send your client a bill for the rest. Unfortunately, clients don't fully understand that they had this QMB program. What happens? The client writes out a check and sends the money to the medical provider. The medical provider, according to the Center for Medicare Services, has violated federal law by sending a bill. The clients don't know that, and they pay the bill. One of the reasons that the clients don't know that is they didn't inform the medical provider, Dr. Jones, the hospital, et cetera, that they had the QMB program. The medical provider had no idea not to send the bill to the client, but to send it to the state. So it's very important that you work with clients and find out if they do have this QMB program, not to pay any bills. There have also been occasions where medical providers have refused to cooperate because they don't understand this QMB program. And we're dealing with one in this ADRC office where a medical provider is just ignoring it and telling the client not, that you owe money, and we're telling the client under no circumstances pay this bill, and we're going to come down hard on the medical provider. So that is an extremely important piece. And I can't tell you how many times, unfortunately, that I've dealt with clients who didn't know they had QMB, didn't understand the QMB program. They knew they had this, didn't understand what it was, and they paid bills. And once you pay bills, getting the money back is almost impossible. So that's just something very important to understand about the QMB program. The other thing that is also important, again, is we put this in the context of people switching from Medicaid to Medicare. When people are transitioning from a health insurance program, and as I've said, I consider the state to be very generous with its health insurance program if there are no costs. Now they're stuck with a Medicare premium or co-payments. What they'll say is, well, I don't want Medicare. I want to keep my Medicaid because I don't have to pay for it. They don't have a choice. Medicare is their primary health insurance. That means they are going to pay most of the bill. What happens is, on occasion, people will say, well, I'm not going to pay. I don't want Medicare. I've got Medicaid, so I'm going to cancel my Medicare. What they think they're doing is they're canceling Medicare and having Medicaid as their only health insurance, and therefore they think Medicaid will be their primary health insurance. It will not. The state will know that Medicare is supposed to be their primary health insurance, and if they canceled their Medicare, the state will not step in with its Medicaid to be the primary health insurance. So it's extremely tempting for somebody on limited income to say, I can't afford the $185. I can't risk the co-payments. I'm just going to cancel my Medicare and keep Medicaid. And as I explained to people, you can't tell the federal government and state government what to do. They have decided Medicare is your primary health insurance. If you cancel your primary health insurance, you don't have health insurance, primary health insurance, Medicaid will not take over as your primary health insurance. As I also said earlier, when you have Medicare and Medicaid, Medicaid serves as a secondary insurance. The purpose of a secondary insurance is to pay the portion of the bill the primary insurance didn't pay. I use that example. You go to Dr. Jones, the bill is $200. Medicare sends the $160. There's a $40 bill left over. You have Medicaid, you can have the bill submitted to the state to pay the $40 as your secondary insurance. So I know that's a lot of information. As I like to say, there are no bad students, only bad teachers. Hopefully I did a good job of putting it all in its proper context for you. Any questions?
I have a question on the website. This is just state website, but it talks about QMB, it talks about SLMB, and then it also talks about qualified disabled and working individuals. Can you talk about that?
I'm not as familiar with that program, Emily, but it's basically
Okay.
the same type of, it's basically all under the Medicare savings program, where again, based on eligibility, based on financial eligibility, the state
Okay.
is going to help you with your Medicare costs.
Gotcha. Okay, thank you so much. Are there other questions? Lots of thank yous in the chat here. It is very helpful.
Okay. What I like to do, it does not matter to me what county you work in. I'm going to give you all my office number, my direct desk number. If you have any questions about this, my number is 603-516-9505. Just tell me you're one of the community health workers that attended this meeting. One of the things that can be very helpful, two things, as a certified Medicare specialist, with a client's permission, we can go into their Medicare account. The Center for Medicare Services can set them up with their own online account, and I can check their Medicare coverage. Also, we have a partnership with the Department of Health and Human Services. If they're applying for one of these Medicare savings programs, we can instantly check their applications. We can let them know what letters are being sent. The state is going to ask for proof of income, proof of assets, etc. They're going to write notes about the person's case. We have instant access to all of that information, and we can get you answers in many ways much quicker than calling a DHHS office and trying to figure out what's going on with their Medicare Savings Program application. All we need is for you to say to a client, there is somebody at one of these Aging and Disability Resource Center offices who can give me instant information. Do I have your permission to call him? Yeah, I don't need a signed release. All I need you to say is, John Smith gave me permission to talk to you. And that is satisfactory to us. I might need to talk to John if there's any questions about his Medicare coverage, and I want to go into a Medicare account. If you're with John, I might say, John, do I have your permission to do this? But again, if John Smith were to say he gave me full permission to check both his Medicaid and Medicare coverage, that's good enough for me.
Excellent. Thank you so much. Does anybody else have any other questions? I'm going to stop the recording.